Ever wondered how marijuana might be affecting your heart's health? Recent studies are painting an intriguing picture. They suggest that regular marijuana use could increase your risk of heart failure, stroke, and heart attack. These findings, presented at the American Heart Association's scientific sessions in 2023, are stirring up quite a conversation. So let's delve a bit deeper into these studies and their findings. Let's start with the first study that caught our attention. This investigation found that those who use marijuana daily are in a somewhat precarious position. They have a 34% higher risk of developing heart failure. That's quite a substantial increase. The study suggests that one possible cause could be coronary artery disease. Moving on to the second study, it sheds light on a specific demographic: elderly non-smokers. It appears that even without the added impact of tobacco, their use of cannabis could be a ticking time bomb. The research shows that these individuals have a heightened risk of major adverse cardiac and cerebrovascular events. These studies are like pieces of a jigsaw puzzle, each contributing a bit more to our understanding of the complex relationship between marijuana use and cardiovascular health. They underscore the need for further research, as well as the importance of healthcare professionals being aware of these potential risks when advising patients. Clearly, these studies represent a significant step in understanding the potential health risks associated with marijuana use. So, what does all this mean for marijuana users and healthcare professionals alike? Well, the crux of these studies suggests a noteworthy link between regular marijuana use and an increased risk of heart-related ailments. This includes heart failure, stroke, and heart attacks. Particularly, daily marijuana users seem to be at a 34% higher risk of developing heart failure, with coronary artery disease being a plausible pathway. Moreover, elderly non-smokers using cannabis are also not immune to these risks. They show an increased likelihood of major adverse cardiac and cerebrovascular events. These findings underline the urgent necessity for further research into the health implications of marijuana. It's clear that healthcare professionals need to be acutely aware of these cardiovascular risks associated with marijuana use. Remember, being informed is the first step towards making healthy choices. Stay safe and stay informed.